Heather's going to come back. She gave a great talk before on genetic testing, and she's going to finish out with 10 tips to work effectively with your NF team, or as I like to think about it, how to manipulate the doctors and nurses who work with you.
Okay, so we're going to do a tag team talk today. You met Dr. Mueller earlier, and this is actually my first time meeting her, so it's been a pleasure to work with her on putting this talk together. I hope you'll find some helpful tools and also some insight into the clinic side as well as the patient side and how we can all work together. So what our goal is to try to give you some tools and to help you be the captain of your own team. So that's our theme today. So remember, you are the captain of your own team. You know your body best. You know your children best. You are responsible for your own health care. And so our job is to give you tools to see if we can help you along the way in working best with your doctors and your clinic. The first biggest challenge that I'm hearing this weekend is finding the right doctor. And we do know that there are a list of the NF affiliate clinics on the CTF website. That's always a good first place to start. I'm involved with that clinic network, and so if you ever have any questions about that, feel free to let me know. If you look at the website, there is a Find a Doctor section, and then further below that is Other Resources. And so the Find the Doctor section is all of the NF affiliate clinics that have a collaboration with the CTF. The other resources are clinics that we've identified that see NF patients, but aren't necessarily formally connected to the CTF. And so make sure you scroll all the way down on the website because there are a number of clinics that we've identified. We continue to try to recruit clinics into the clinic network and also find other clinics that you all might have access to. If you can't find an NF clinic near you, genetics is often a good place to start if you have a genetics clinic near you or a neurology clinic, touching base with them to see if there are, if they see a number of NF patients, if they have experience with it. Also, if clinics are willing to learn about NF, that actually says a lot about the doctor. If they're saying, you know, I don't know much about this, but I am willing to research, I'm willing to call the specialist, I'm willing to work with you. So I know those doctors are hard to find, but they actually are out there. The most important thing, of course, is to feel comfortable with your doctor, have a connection. You need to find the right fit. There are, better doctors than others. There's better patients than others. We have to figure out who's best for us. And so one doctor might work great for one family and terrible for another family. It's just the reality of personalities, approaches, and things like that. So you have to feel comfortable with the doctor that you're going to. It's also really important to have a good primary care physician and somebody that you can trust. Many people go through their internal medicine doctors or already have a set doctor that they have a connection with. If you're in the situation where you do not have one of those, you can start with an internist. You could call one of the pediatric clinics, or if your child's in a pediatric clinic, they actually have kind of a behind-the-scenes way to look for specialists in med peds. And med peds are specifically trained doctors who know about internal medicine and pediatrics, and so they would be a very good primary care physician to follow you.
I should probably put a disclaimer on that slide because that's my training, and so I spent 4 years. Normally a pediatrician trains for 3 years and an internist trains for three years, but there's actually a training that combines the two of them so that you're a pediatrician and an internist at the end, and that's the 4-year training. So I'm sorry if my bias shows up a little bit in this presentation, but...
Okay, so tip 2 is to be prepared for the clinic visit. So make sure that you have the location of the clinic, directions on how to get to the clinic, who you're going to see, how long the visit's going to take. That will help you feel more comfortable about the visit. Also make sure you get all your records, sign the medical release forms, get your scans sent. If the clinic has any forms that you need to fill out, insurance forms, things like that, make sure that you bring those along. It'll all help with a smooth process so that you're feeling more comfortable through the process. Whoops. Okay.
Actually, I'll add to that comment. One of the biggest frustrations I see patients experience is they come in and they have a certain set of questions that they want answered, and the doctor expects that visit to take 15 minutes, but if you look at the list of questions, there's no way that that's going to happen, plus everything else. And so understanding how long the visit is before you get there is helpful. If there's any flexibility at all in asking for a longer appointment, that would be an extremely prudent thing to do. So tip number 3, encourage collaboration. I can tell you that physicians tend to have very busy schedules, and so it's very hard to do this, and so that's why I think having the patients push for this collaboration is very helpful. Everybody needs to act as a team, sharing records, communicating, reaching out to each other, and then also the transition plan. I know many of you are parents of children who have NF, and you want for their care to be continuous, and so having a good transition plan is very helpful. This particular website, the gottransition.org, has a lot of helpful resources on it, things like a portable medical record, so if you're sending your child off to college, they have something they can take with them, and some other tips and resources. And so that's a really helpful place to look if you're worried about getting all of the information concise. Part of transition, though, of course, is also teaching your adolescent about their disease, which I heard many of you talking about in the audience today, and that's a really crucial part of them being their own advocate as they're entering adulthood. So we did want to mention organizing the information. I already mentioned the website there with the GOT transition, but a binder is really helpful. I actually love it when families come in and they've got their binder, and I realize that sometimes it looks a little daunting because it can be pretty thick, but to have all that information together in one place, hugely helpful, especially if your physicians that you're seeing, the specialists, are in different locations, so they can't see each other's notes. So the things that you want in that binder that are really key are the list of medical issues, medications and allergies, very important. The surgeries with a date and a brief description, it's helpful to have that in some kind of chronologic order because then they can just scan down. The current doctors and clinics, and actually something that you can hand to your physician with that information so that they have it when they're dictating letters or whatever they're doing, also very, very helpful. Clinic notes that are relevant. So, for instance, we've heard a lot about testing for learning disabilities and ADD. If you have that summary letter from your psychologist that did all of that testing, absolutely have that in your binder because that's incredibly helpful information. And then tests, we mean by that both labs and imaging. The imaging results are especially important. You've heard that there's a certain frequency that you might have certain scanning tests done, and to have all of that in one place is really great. And then if there's been specific treatments, if you've been in a trial or you had optic glioma, let's say, and had radiation and chemotherapy, when that was and how much was involved, because there's additional things your physicians might want to think about later on. And then if there's school or work documents that are important, you mentioned somebody asked about disability for work. Sometimes FMLA becomes important, and actually having a copy of your FMLA paperwork, again, your physician is going to be extremely happy if you have that because it makes it so much easier to fill it out again and make sure it looks the same so that your employer doesn't have a hard time with it. And then do try to bring the binder to every visit. Very helpful. Okay. So as a physician, I can tell you there's times when you need to reconsider your team. If you feel you're bringing a complaint to your team and it is not being heard, One of the things I have learned from my patients with NF is that you should never ignore or minimize a symptom that they're having. It's really important that you're listened to. Now, sometimes it might be stress or it might be something else, but it very well could be something that needs to be paid attention to. And there's steps that should be taken to make sure that it's not due to something wrong with your NF or some other significant physical problem. Our bodies and our minds are together, and we've been hearing again all day today how closely they relate with each other. But it is sometimes a problem if someone dismisses that, they're just anxious or stressed out. And then being patient-centered is another key thing. The medical community has come a long way in the last 10 years in terms of realizing that it's the patient that's the most important team member and the rest of us are there to support the patient. You definitely want to get that feeling from your medical team, that they're about you and you getting your answers questions and you getting your needs met and you having the life that you want to have. If you feel like things aren't going the way that you'd like them to, don't be afraid to ask for a second opinion. Most physicians who are comfortable with what they know will not feel badly about this, and so I know sometimes people feel like it's I don't trust you. It's not that. You want to hear from someone else. That's totally your prerogative to ask for a second opinion. So. Okay. So calls. So I'm a primary care physician. I have to tell you, calls are like so difficult to get to, and maybe most of your doctors are better at it than I am, but I really struggle with this one. So when do you call your NF doctor and when do you call your primary care doctor? So if you have a question that you know is related to your neurofibromatosis, one of them's growing, or you're having a problem that you know is related to something that's going on with NF, call your NF doctor. If there's questions about your NF treatment or protocols or research or any of those things, again, please call your NF doctor. If there's specific school work or emotional difficulties that are related to the NF, then also probably the NF doctor would be your first call, although that depends on how close you are with your primary care doctor. Any illnesses that you have that are unrelated to your NF should go to the primary care doctor or your child's. And if you're not sure, it's always okay to start with your primary care doctor as well.
Okay, so here's one that all of us could use, is to be patient. Remember that doctors are being asked to see more patients in less amount of time. So as care providers, there's also a struggle between wanting to make patients do the best for our patients, pleasing our administration, and trying to find the right balance there. So we have to figure out ways to deal with it on the healthcare side too. And so by doing that, we have to prioritize calls. So we're going to deal with the most urgent things immediately. So if a patient calls in, we're concerned about a brain tumor, we need to get that patient in for an MRI immediately. Some of the other phone calls that we get may be a little bit less urgent that we can put off for a day or two. When leaving any type of message, always leave details, leave a name, a phone number, and a concise question. Don't feel like you always have to talk directly to the doctor. Sometimes the nurses, the clinic coordinators, the genetic counselors can be great resources to start with and can track down the doctors easier than anyone else can and get back to you actually quicker. So feel free to use all of the resources in the clinic. And be understanding also if they're running late. So sometimes I wish there was like a behind the scenes in clinic going on to see that most of the time the doctors aren't just having a leisurely lunch while you're waiting in the waiting room. It's probably something like they're in another room and there's a more urgent thing that had come up unexpectedly and it's taking them longer to deal with that issue. But the reassuring part of that is that when they come into your room, hopefully they're going to be treating you with that same respect and address your same issues if they come up. And so kind of trying to realize that even if we end up waiting, and I'm a patient too, so even if we end up waiting a long time in a waiting room or in the exam room, understanding that there's probably other things going on that led to that wait, and sometimes we just need to plan for that in our day.
You've been hearing a lot about research and involving the community and making progress in terms of a cure for NF. One of the very important parts about getting providers who understand NF and have experience, whether it's genetics counseling students, nursing students, or physicians, medical students, it's really helpful if you are open to training them. So when I spoke earlier, they mentioned that half of my job is actually training young physicians to become practitioners. And when patients are able to explain their symptoms and engage the residents and show them what their life has been like, they learn so much more about that disease process than if they read 10 pages in a book. So that connection that you make with that trainee, don't think of it as, it is asking you to give something extra that you wouldn't have to give if you didn't have NF, but you're also giving them a way to give back to the community as well. And so taking that time to include them and help them understand what it means to have NF and to have, live through it yourself is incredibly helpful to them in their learning process. Because I started doing the NF clinic with Dr. Shorey 20 years ago, a high percentage of my clinic patients have NF, and so the residents that train with me and work with me know a lot about NF now because of that, and it's a really wonderful thing. The other thing that trainees do, and I find this all the time, and it's actually been shown in the literature, that having trainees involved in your care improves the quality of your care. And they think that is in part due to more heads together thinking about what's going on. And maybe they think about something that I, hadn't come up with, or, something that they picked up on the history. Those are really important things that can help your care and improve your care as well. So it's not all bad if there's a room full of people who want to try and learn about what's going on with you and want to help you. Hopefully you don't mind that too much.
Okay, tip 9, use your resources. So recognize the need for additional support by families and friends. Remember the role that emotions have on all of us. So when we're in a crisis situation, an emotional situation, we might understand things differently, we might cope with things differently, we might remember things differently. And so kind of keep that in mind as you're thinking through kind of the process of your medical management and care. Also, feel free to look for additional resources outside of the clinic team. Go to different websites, the CTF support group state chapters, other types of things that are on the internet, social media things, that kind of thing. And so feel free to use those resources. At some point, some families do feel the benefit of going to a counselor or a therapist as well. So recognizing that it's okay to do that. Your family might be struggling enough that it is very okay to do that. And so giving yourself that permission to say, okay, I'm really struggling, I need to get back on track, put this in a new perspective, and move forward.
So our last tip, it's somewhat of a review of the prior, but to know the expectations of the visit. That has to do with time that you'll have with the physician and what you'll be able to accomplish in that visit. Bring your top 5 questions. Actually, 3 might be more realistic, but the main things that you want that physician to focus on, and try to minimize any of the smaller things as far as discussion. Bringing your binder, which is all the incredibly helpful information that you have collected over the years. It's really helpful to bring a friend or a family member, especially if you're going to be talking about a new diagnosis or a new treatment, because you'll remember different things and they may be more able to absorb that information and help you later on when you're trying to make decisions and you can't remember all the details. it is fine to take notes or have your friend or your family member that's with you take notes so that it's more clear and later on. I like to type notes, but then that takes the time away from our visit. And so anytime you can write down instructions and really make sure you're clear is incredibly helpful as well. If you need an interpreter or you're with a family member who needs an interpreter, feel free to request that. It can make a big difference in visits. A couple of our NF2 patients who have lost their hearing, they may read lips or have aids, but they still like having this, the ASL person there. That's a great way to improve the communication in the visit. If you feel like you aren't completely clear about something, don't hesitate to ask questions, and you can ask for written instructions. They did a study where they found that only 50% of what was communicated from the physician during a patient-physician visit did the patient remember. So half of what we're saying basically isn't getting through or isn't remembered, and that's a really scary number to me when I think about the time that we spend in the room and what I'm hoping that we're conveying. And so writing that information down and going over it, there's something we call teach back, where the physician says, hey, we just went through a ton of stuff. You're going to talk to your daughter tonight about the visit. What are you going to tell her about what we discussed today? And that gives the patient the chance to actually say this, this, and this, and then we can get it clarified. So if your physician asks you to do that, don't feel bad. They're really trying to make sure that you learned everything that they wanted you to learn. And then the follow-up plan, also really important. Is this something you're monitoring? Is this something you're testing? Is this something you're being referred for? So that you feel really clear, like this was the problem I brought to you, this is what you're thinking about, and this is the testing that we're going to do for that. This is actually my chief resident, who's being the patient there, and one of my colleagues' sons, who's the doctor now. But really, the picture is meant to remind you that your child or yourself or your family member who's affected with NF, really, we want them to feel like they are the captain of that team. Obviously, for your children, it's going to be you, but you're teaching them as they're growing up how to transition into taking responsibility and advocacy for themselves. So I think we've got a couple of minutes for questions. Mm-hmm. Yes?
Taking notes and retention and all that stuff, because it is always a mix of logical and emotional while you're in there, so it's kind of tough to retain it all. Is it inappropriate to ask to record it, or are there legal restrictions on that? Or
so there's no legal restrictions that I know of. I think especially if you're getting news that is difficult to process, that recording it is fine, but you would want to discuss it with the physician first and explain why. But especially if there's a difficult diagnosis or treatment schedule and there's a lot going on. When we talk about giving very serious information to patients, there's lots of steps that we like to go through, but being available and being understood are probably the two most important. So with that in mind, recording is fine. If there's awkwardness in the relationship, that it could promote defensiveness, depending on being prepared for that, basically. So the question was recording the visit. I'm sorry, I forgot to repeat the question.
Yes, I had twins 50-some years ago. One of them had NF and the other one doesn't. How common is that?
So if the twins are from, they inherit it from you, I gather? Yes. So if the twins are from two separate eggs, then it's 50-50, that one will have it and one won't. So, was I clear about that? It's the same inheritance pattern than if they were two separate children. So I think you were the same patient that said you stopped counting your neurofibromas, or someone here did, and someone asked about menopause. And I do think, if the universe was fair, that neurofibromas would stop growing with menopause, because there really should be something nice about it. But it's not entirely clear that that's the case. So. Everybody's all set? Okay. Thank you so much.
Thank you.